Okay. Thank you all for coming to our Lunch and Learn for November. It is with great pleasure that I want to introduce Dr. Janet Kennedy, who's going to talk today about student mental health and wellness for preceptors. Dr. Kennedy, whenever you're ready, thank you.
Great. Thank you so much for having me. I'm really excited to be giving this talk. I now teach full-time here at Western New England University, but I think I was asked to do this talk from my background as my training as an MD and working for many years as a psychiatrist in all different settings, including also with students as well. Um, and also working as a preceptor for both hospitals and programs in Boston and here in Springfield. So I hope to bring all of that here to this talk today. And it's really hard to fit student wellness into 30 minutes. So I pulled together a number of things that I thought were really important to go through. So talking about recognizing wellness challenges, I think is really a great topic, and kind of figuring out what to do if you have concerns, and also ways that hopefully we can support students proactively, and not get into some situations. So, and at any time, stop me if you have any questions or there's anything you want to talk about further. I'm happy to talk about whatever is the most helpful to the group. So, I love this quote because sometimes some of the most challenging situations or students that we're working with, it is very difficult, but it's actually a huge opportunity. And we can sometimes that's the thing, that interaction, whatever you had with them, is the thing that can really change things for the student or turn things around. And it really can be very valuable, even though it might not seem so in the moment. All right. So I we'll talk about some things you're probably well aware of, but I think it's really important for us to think about it when we think about our student population, which are some facts about how we are doing with our mental health overall. The answer is not good, as you know, but I love some of these statistics. So, this one from the Harvard Business Review showing really looking back for those COVID years, things have gotten so much worse. So, 85% of this huge, huge study reporting things have gotten worse. And the biggest part of that was mental health decline. And other data out of the CDC and the Behavioral Risk Factor Surveillance System. So, young women's mental health worsening the most. If we look here, our more recent cohort, females between 2019 and 2023. If we look at on the bottom, we're seeing their the age 20 to 30 to mid 30s. We can see how that is getting worse. Now, this is asking a question of how many days in the past 30 days was your mental health not good. So a higher percent of days is bad. So we can see that younger age group, exactly the people that we're talking about when we're thinking about who we're working with, right? And the same thing is true for men, although the overall number is about up to 10% in women, is up to 7% in men. Still, it's that younger group whose mental health has really worsened. Some of you might be familiar with the Healthy Minds study, a really great, humongous study of college and graduate students. So, exactly who we're talking about again. And so it asked them all kinds of full symptom inventories about different mental health conditions. So, when we look at this study, if we look here using the PHQ-9 depression screen, 38% are reporting any depression on that. That's huge. Those are the people that we're seeing day in and day out, right? And then the same thing for the anxiety screen, 34% any anxiety. And also, I pulled this one too, loneliness. Sometimes we don't think about it enough, but if you add up the green and the blue, 67% reporting that some of the time or often they felt isolated and lonely. And again, this one has a lot of statistics on it, but looking at again 20% of participants in this study reporting having severe depressive symptoms. And then we see again that 38% moderate or severe depressive symptoms on these scales of depression. So a lot of people, also a bunch of other disorders accounted for here, including suicidal ideation. All of these things are going on in the population that we're working with. And sometimes it's really hard to remember that that's what these students are going through. It has been categorized very many ways. Trying to put it in a more positive light, this study also looks for some dimensions of positive mental health. So, looking at a scale of flourishing, sometimes thought of as positive well-being, um, 38% reporting that they met the criteria for this positive mental health. So good, that is 38%, but we were kind of would expect it to be more, would hope it could be more. So students are just really struggling. And the last statistic that I'll show is this one that really hits home to me, which is when they asked about academic impairment. So they're endorsing all of these symptoms, some meeting criteria for severe depression, but really looking at in the past 4 weeks, how many days have you felt that emotional or mental difficulties have hurt your academic performance? And 75% are saying that yes, at least one day of the last 4 weeks. So if we're thinking about 4 weeks on a rotation, at least one day, 75% of students are reporting that their mental difficulties were getting in the way of doing what they needed to do. That's huge. And I think it's so easy for us to forget that, to not take that into account when we are thinking about our students on their rotations. So, if we think about what it's like for a student on rotation, some of you, it hasn't been too long, maybe since you've done it, but I think even for myself, it's so easy to forget the other things that they're dealing with. And so I think it's important for us to just take a moment and think about what it's really like for them, kind of remembering all of those pieces that are part of being on rotation, whether it's academic pressures, maybe they have other things going on. They're a fourth year, they're preparing for exams, they're maybe new to being in the clinical world, there's things they're not used to. Um, Even just this transition to being maybe they haven't been in a hospital before, and the adjustment to all of that can be really overwhelming. um, and managing different patient interactions, maybe not so pleasant patient interactions, all of those things are, to us, maybe we're very used to it, it doesn't seem like a big deal, but it can really have an impact on our students, especially those who may already be facing some mental health challenges, as well as personal factors, right? So some are under a lot of financial stress. Maybe they're working more than we would advise them to, but they have to. Maybe they are having major relationship stress or family problems at home. Maybe they're not sleeping or eating well, whether it's due to a mental health condition or another reason. And or do they have an actual diagnosed mental or physical health disorder that they're dealing with as well? Are they away from home? So we can think about what they might already be facing, what they are facing in this rotation or whatever is being expected of them on this in this clinical experience, right? And thinking about some warning signs that we might see. I like to think of a student who's thriving, right? You can all think of someone who's doing really well. Maybe they would be that 38% on the flourishing scale. Um, Kind of we're thinking the opposite. What are some things that that person didn't show, right? We all know the warning signs. However, I think it's so important to think about them together and talk about them. So these are things like we'll list their work declining quality, but if you're only seeing them for a month, their work might be poor quality, right? They might make a lot of errors. They might seem like they're having trouble retaining information. Are they procrastinating, coming late, missing deadlines? Are they not really participating? And I like to stop here and really think, because some of these things we often are seeing and we're right away attributing it to this. That's how the student is. They're not going to do well in this rotation. They can't do this work, right? But maybe it's something else going on. I actually had a great example of this happen this weekend, not in a clinical setting, but a student who sent me multiple emails this weekend with that red high importance explanation point on the email late Saturday night. They were not high importance. And then continued to send me emails concerned about a course she was failing that I'm finding out about now in this semester instead of much earlier. including a screenshot of her grades, which showed multiple kind of free points assignments, practice problems for the exam, zero for not turning it in, right? So my first response, right, looking at some of these, someone coming late, someone not understanding something on the rotation, right, is like, how dare they? Why, how unprofessional. I need to talk to her about sending emails like this, right? But I said, I'm giving this talk on Wednesday. Perhaps I should think about it first, right? Maybe something is going on with this student, and it might change how I interact, what I'm going to do next. And it can make a huge difference in what's going to happen with that student, right? And even things like coming late. Now, it doesn't mean that and now if there is something mental health going on, the student should be allowed to pass, the student should be allowed to come late, right? But it's just a little bit of a different approach, kind of being really sensitive to maybe something's going on with this student. And I was able to take a step back, think about my email response, ignore the maybe unprofessional parts of it to start with, at least to kind of have a conversation. And we'll talk about kind of things to say. But really, I think it ended up much more productive. Yes, the student is really facing something that is very difficult that she didn't share the details of, but clearly this wasn't how she was a year ago. This wasn't how she normally interacts, and it was so important to have that perspective. So some other warning signs, again, things that we're often just kind of thinking it's the person, right? It's the person themselves. This is how they want to be. If they're really late or calling out, maybe they seem really anxious or hesitant to do things that should be pretty simple. Maybe they're either not caring about things or they're caring about things too much, having an inappropriate emotional response or avoiding things, as well as things like being really tired all the time, being sick all the time, um, having not good hygiene, right? Or seeming like they really aren't sleeping. So these can be unrelated to mental illness, but they also can be related. And so sometimes, again, just having that step back to this person really isn't dressed well, they're not acting professional, they're late every day. Sometimes it's helpful to first explore what could be going on, right? Um, Perhaps they were completely different a few months back. Perhaps this is a huge change, and that is a huge sign that something's going on for this person. It's hard to know if you are only seeing them for a snapshot. And then there are some signs that are really going to tell us that, this very well may be a mental health condition. Like if they seem really sad or having mood swings while on our rotation, really seeming anxious outside of the realm of normal, even being really irritable or angry towards other people working in the clinic or towards patients, not engaging, being isolated, if they're saying that they're really overwhelmed, and obviously if they're mentioning self-harm, suicidal thoughts, or if they have any signs of substance use. So what do we do if we're kind of suspecting things? So for our immediate response, so if we're at the stage where it's something maybe unprofessional, maybe they're coming late, maybe you've asked them to do something and they keep forgetting. So the first thing is to really, if you can, you're so busy, but to just jot it down. I do this all the time, even in class. Someone comes in late, I just jot a quick note every time. And that way, that if this becomes a problem, you have your notes. You have on this day, I asked them to do this. They didn't. They left without doing that. And when you write it down, you don't want to put any emotion into it. It's just a factual account of the date, what happened. It can take you 2 seconds to write it down, but it can be really helpful if this does. Hopefully, it does not become a pattern. But if this does become a pattern and you end up, hopefully, you're letting us know what happens. But sometimes it's something so small that you're not gonna talk to us about it. It might be something you don't even talk to the student about. It was pretty small, but it's sometimes helpful to just write it down so that if it keeps happening, there you have it. There you have all the dates that this happened or different things happened, that really help reinforce your understanding, our understanding of what's happening with this student. And then, so for a lot of these things, again, they're not things that you would talk to someone else about, right? So you would be the one having the initial conversation with this student. So thinking about what can you do in your limited space and time to maybe just it's time to talk to them about what's happening. Can you find some place private to talk about it? Um, can you try to take that step back? It's so frustrating. They keep coming late, but take that step back. Maybe something else is going on. And to really focus on the behavior rather than assuming, I can see you don't care about this rotation, something like that, right? And really trying to listen to what they say. So I always find it helpful to actually have the vocabulary to say some of these things. So I uh, wrote a few things out that you could say that are, really kind of general, really kind of just tell me what's going on, right? I wanted to check in because I've noticed you've been coming late. Is everything okay? I might be reading too much into it, but you seem a bit stressed. How are things going for you right now? Or something like, I just wanted to take a few minutes to see how you're doing, not just academically, but overall. Or would you be open to sharing how things have been going for you recently? And maybe they do say something like, I'm overwhelmed, something like that, right? I want to make sure you're getting the support you need. Is there anything that could help right now? Or would it be helpful if we talked about some resources or options for support? Maybe they say, no, I've got it. I've let someone else know, right? Um, or maybe they say, I do have something going on, but I don't want to talk about it. Something like, I appreciate you sharing what you're comfortable with. If anything changes, my door is open. Let me know, right? And so kind of the outcome of this initial conversation, this is where you're using your own clinical judgment, your own expertise, right? So it can be that they're saying, no, I'm totally fine, right? And sometimes then it's okay, that's great. So we do need to follow the rules of this rotation or whatever it may be, right? You do need to get your work done before you leave every day. So how can we figure out how to do that, right? Or we do need to get here on time. Is there a way I can help you think through how we can make that happen? Um, or maybe they're telling you, I'm stressed. I'm staying in this, I rented this place for this month and it's terrible. I'm not getting any sleep, right? And so it might be, well, we still need to find a way for you to follow all the expectations that you need to meet this month. But what could we think through together, right? Is there something that we could do? Have you tried this? Would you like me to make some suggestions? Would you like me to connect you with the experiential office? They can talk to you about what you can do, right? So again, even if they're saying I'm really depressed, but I'm in treatment, right? And I'm working on it. It's not a that they don't need to follow the expectations, but at least you're kind of understanding and working with them on what would make this easier, right? What could we do so that you can still get here on time? Can I help you think through what you're doing in the morning so that you can get here? Maybe there's a better way to drive. Maybe there's a different bus to take, right? Things like that. So it can really go a variety of ways. Obviously, if they're open and they're telling you things, any mention of self-harm, suicidal ideation, if there's any suspicion of substance abuse, whether they admit to it or not, or a behavior that is compromising someone's safety there, or they appear to be in crisis, clearly that would be something that you would contact resources right away. So letting D. Madison or any member of the experiential team know here, as well as what you would normally do for a staff member or patient in crisis. And for our preceptors across the country, I think it's important to know that our counseling service here, which is really excellent, does is able to see students one time for a consultation no matter their location. So it is an option that you can always give to students if they haven't yet seen our counseling services. It is a great option for them. But certainly letting us know, obviously, an emergency comes first and then letting us know after. But those would be kind of for those extreme circumstances. But let's talk about some proactive ways that hopefully we can not end up in this situation where someone's in crisis and we maybe haven't been able to talk about it yet. So um, I also um, have a lot that I've thought about on this topic. I used to work for about 5 or 6 years. My role was as a process group leader, which is something in our medical residency training that psychiatry and some other disciplines have a group where the students are able to meet and kind of process what's going on, talk about how things are going. Maybe a good idea for many programs, but so through that, it's a confidential group, and I'm there as a facilitator. I got to hear a lot of what they said about their preceptors and how things were going and what they liked and what they didn't. And I feel like that was really helpful for me. Some things I hadn't thought of, some things that you might not think about that students are seeing. That would be helpful to them, right? And helpful to us all to understand. So you're in a busy place. There's not a lot you can do, but as you know, as much as possible, kind of really trying to create a good environment for their learning. So hopefully, when they're coming in, you at least can do some sort of orientation with them. And for some, it's even the basics of what to do, like what kind of breaks you should get, where to go to the bathroom, where to put your lunch, right? And kind of how the day works, what's expected of them. If you're not the one seeing them on their first day, making sure that when you do see them, they're aware of these things. It helps them so much to really have that little mini, even if it's just a few minutes, knowing what to do. And even at that time, asking them how they would like to receive feedback, right? Or maybe you have a way that we meet every week for 5 minutes to just touch base on how you're doing, right? Maybe you have something and it's a great time to let them know, or maybe you can ask them. And another piece is really focusing on giving any feedback in a constructive way, right? What they could do differently. And also, if there's any room for it, to also provide some positive feedback, something that they did good in that day, as well as things that they need to work on. Hopefully a bit of an environment where if they have a lot of questions or make a mistake, that they feel like that they're learning and that it was okay that they tried this. Maybe they did something, they had to redo it before giving it out to the patient, but that it was okay because they're just learning. And also having those regular check-ins. I think we've seen situations where you may not be happy with the student's behavior, and things are progressing, and next thing you know, you're at the end of their rotation and they don't know that they weren't doing as well as expected, something like that, right? So really kind of having a check-in that, I know you're working on trying to get better sleep at night, but you're still late 3 days a week, and that's going to be on your evaluation. So, letting them know kind of what's going on, that you want them to work this out, but that this is what it's looking like at this point, right? Um, as well as, so some people may not feel comfortable, some may feel comfortable kind of talking about wellness. It's not something that was done when I was in training or anything like that, but now they're talking about this. Some of our younger cohorts of students starting in elementary school, middle school, so really talking about it, talking about how they're doing. Validate that feeling overwhelmed when you start is normal. It's temporary. You're going to feel better about it. If you feel comfortable asking during check-ins, how are you doing elsewise? How are things otherwise, right? And if you feel comfortable, you could share your own experience, like how you are managing, right? How you're managing the stress, maybe, and kind of what you can do for self-care, how to manage their time, right? How they might need to really be told how to get things done in the time that they have there. And this includes things like things that are stressful, a very difficult patient interaction. Sometimes you may not think to let the student know that was really upsetting for me too. Here's how I deal with it, right? Here's what I've done. I remember when that used to really upset me. It was really hard to be yelled at. But these are the things that I do. I step back for a minute. I take a few deep breaths. And you may not see me do that because I'm so used to it now, but in the beginning, that's what I did. Or if you need a minute to process what just happened, it's okay. Things like that. Sometimes we don't think about talking it out because we're so used to it. But for students, it can be really helpful for them to hear that part that you're probably doing anyway to manage your stress. Here's what I'm doing on my break. Here's what I'm doing to relieve my stress. Sometimes it's really helpful for them to hear that. Um, and also ways to set boundaries, whether it's patients or other people in the workplace that you're in. as well as accepting that some students may still be struggling despite all that you are doing. You're certainly not there for therapy. You're just kind of there for kind of support. Sometimes you're the one kind of recognizing the problem and passing it on, whether it's to professional resources, to the experiential office, right? And knowing kind of when to do that. You're definitely not there to help manage whatever they have going on mental health wise, but just to kind of help get them to that next step and taking care of your own wellness, which we could talk forever about, which is easy to say, hard to do, right? But clearly, that's a really important part of if you're feeling good about things and where you work, it's much easier to pass that on to the students. All right. We have just enough time to see if we have any questions. Are my final points. Clearly, student wellness is a responsibility for us all, the institution, students, and the preceptor, really trying to identify some of these warning signs early can really help prevent things from getting worse. And hopefully, we can provide some environments that can help learning, patient care, and the student themselves as they're developing and learning all they need to learn, and hopefully a little bit of time to take care of your own wellness. I put one more great quote at the end. So true. Some students really doesn't feel like you're maybe making a difference in that time that they're with you, but sometimes the fact that you were supportive, that you asked questions, that you tried to understand what was going on with them can make a huge difference. All right, we have a couple, just a few minutes left. I hope that was helpful. If there's any questions, I'm happy to take them.
Jana, are you busy next year for the preceptors conference? Then you can have a whole hour. And this
An
is
hour.
topic is really
It's hard to
great.
cram it in. That's right. It's hard to cram it in. Hopefully
Thank you
there's
so much.
one little thing everyone
Yeah.
can learn.
And the slides and everything will be up. Don will post them in the library. I was wondering if no one else has a question, but I can wait if someone's. But I was wondering what you do when a student they come to you and they're not well, but they don't want to do anything. They don't want you to tell anybody. Um, but you've at least made it that they'll come back to you again next time. But how do you get around like don't tell anybody? I don't want to, yeah, like I don't want to do anything about it.
yeah, that's such a great point. And sometimes they, like even the student I mentioned, I don't know the details, right? Just that they're struggling. And it's especially hard, I think, kind of my go-to is a, suicide assessment, doing all right. So that's not the role, right? That's not your role here. It's just you offered, right? So sometimes if it's so concerning, right? If they were doing, if this student emailed me something that I was really concerned about, sometimes you do need to pass that along, right? And make sure that their safety is okay. But if right, a lot of times it is like, no, I've got this. I'm just dealing with a lot and they don't want to say, and you're concerned. But I think the fact that you even mentioned it is so helpful. And the fact that you at least opened the door that, hopefully that they will come back to you. Sometimes you can also, I'm happy to let you know of resources if that would be helpful. Um, Email me. I've had a few students who, they just wanted pointed in the right direction, right? Set resources where they could go. I don't know if they went or not, right? But all I can do is offer. It's a great question, and sometimes you are concerned. Hopefully, it's someone. If you're seeing them again, it's not the end of your time with them. That you can kind of check in. I mean, and they may say, "No, I'm fine. I don't want to talk about it," but that you at least kind of if you want to talk, I'm happy to. If there's anything I can help with, um, kind of leaving the door open is all you can do in some of these circumstances, and then hopefully in the day to day work, kind of helping them see the things that they can do and how to really be successful in this part of the clinical work that they're doing.
Thank you. I really appreciate the line about you're there for support, not therapy. I feel like over the years I've, you know, gotten in a more, not that I'm qualified to be a therapist, but I've gotten in the role of, that kind of thing instead of support. I mean,
It
yeah.
It's true. It's hard. Sometimes you just want to keep doing for them, but I think it's definitely not our role, right? And so to really think about how to make that transition of here's the number for counseling or here's this or here, meeting with Dean Burr and start passing it along, right, to the right people who should be the ones maybe talking about that with them. But it's a fine line. It's definitely a fine line. So if there's any other questions, I'm happy to take them. Otherwise, I really appreciate everyone's attention and appreciate the comments in the chat as well.
Thank you, Janet.
Thank you so much. Yeah, there's just a couple comments in the chat. Great topic, great timing at this point in the semester. And thank you. So timely and helpful to check our initial judgments or thoughts and to ask questions before we figure out our response. So certainly hits home with all of us, I think. All right. Thank you all.
Thank you
Again,
for
this will be
thank you.
recorded in the library for anybody who wants to revisit it or check out the slides again or pass it along. Thank you, Janet.
Thank you so
Appreciate
much.
you. Thank you.